Kaylan. Today we're going to perform an ear exam. Is that all right with you?
Yes.
Okay, so if you can just look straight ahead, I'm going to examine your ear. So I'm checking for the color. I'm noting any changes in the skin, and I don't see any. I'm feeling the lobule, the auricle, as well as the tragus and the mastoid process, and I'm actually going to be pressing on that. Any pain on the tragus?
No.
What about the mastoid process?
No.
All right. So next, I am going to use my otoscope to look inside your ear. Okay, so I'm going to pull your pinna up and back and just insert my tool and look at the landmarks. I'm checking the tympanic membrane. The cone of light is appropriately placed. There is no nodes, masses, excessive cerumen buildup, as well as other lesions. Next, I'm going to perform the whispered voice test. So what I'm going to have you do is cover your left ear. And then I'm going to whisper two words, and if you can repeat them after me.
Basketball. Apple.
Okay, so I would do the same on the opposite ear, inspecting it, palpating it, as well as looking at his tympanic membrane and repeating the whispered voice test. If I notice any deficits in his hearing, I'm going to use my tuning fork and test him for Weber and the Rene or Rhine, which measures air conduction and bone conduction. So first we're going to do the Weber test. I'm going to put this at the middle of your head, and then let me know whether you hear the vibrations equally or more so on the left than the right, or the right more than the left. Do you hear that equally?
Yes.
Okay. Next, I'm going to perform the Rhine test, and this measures air conduction and bone conduction. So first, I'm going to put this behind your ear on the mastoid process. And once you stop hearing the vibration, raise your hand so I can move the tuning fork next to your ear.
No.
Do you still hear it?
Yes.
Okay. So air conduction is greater than bone conduction. So that concludes our ear exam. Do you have any questions for me?
No.
Thank you, Kaylin.